So Ancora is an end-to-end population management platform. So you need to think about stratifying patients on the one hand and providing prioritized care, to the delivery of different types of digital therapeutics and interventions, including remote patient management, right? So using this platform, we've been driving value-based care at different steps of what we call the patient journey, right? So it's important to realize that a patient journey starts sometimes before you're a patient, in this sense. That's where our stratification comes in, but also it enables us to manage patients over time, longitudinally, and combining different types of data. So one of the things we're very proud of having done is something that is very intrinsic to the Dutch landscape, which is blurring of the care lines, right? So you'll be talking about primary, secondary, tertiary care. In fact, the Netherlands starts providing reimbursed care already on the primary care level for prevention of cardiovascular disease, obesity management, etc. So we've been collecting thousands of prongs in a number of patients over the last year and a half in this insurance reimbursed program, which has enabled us to qualify activity, qualify quality of life, qualify nutrition, and actually use it in a preclinical setting. And this is something that has had true impact in the care that we deliver to these people. So we actually deliver the end-to-end solution where we prioritize the patients, we profile them, we actually collect their experience and outcome measures throughout the entire program, and we deliver the lifestyle and medical advice that helps them navigate this journey. We actually at Ancora have a firm belief that our technology is extremely symbiotic with what iTrump is promoting, right? As we said in the workshop about the use of AI tools, right? One of the key elements of actually deploying AI, both responsibly as well as effectively, is having standardized data, right? So the idea that iTrump actually provides you with standardized IT-ready sets is something we value a lot. One use case we are also working on gradually is on how we implement these standardized data sources and deliver standardized care through the remote patient management platform of Ancora, right? So you need to think of it as the following. When a patient goes in their patient journey, it's important to collect data systematically, periodically, according to a defined care track, so that both clinicians, healthcare providers, the patient, administrators, everyone in the quadruple aim actually is able to see the data when they need it and act on that data. So one of the things we believe the technology of Ancora can bring to iTrump that it's right now missing or in a very early stage is transforming and accelerating that transformation from collection of data to the so what, right? How do I actually collect the data and make actionable insights for both patients, clinicians, and other stakeholders using our technology? That's something we have developed in context of a multitude of programs, and we actually want to deploy more and more in the field. In addition to what I just mentioned, right, about the use of standardized sets and the opportunity to collaborate with many stakeholders across the value chain, one of the reasons why we chose to partner with iTrump is because we want to be at the forefront of that transformation, right? We as a transformative partner of iTrump believe that, the days are past where it's about learning this and doing that. I think at the theoretical level, we've been nailing value-based care as a society already for 20 years. That's how, Jennifer also started her address. And I think what we are ready to do as Ancora is to help iTrump partners, other partners, to help other stakeholders and drive the change in the field with new technologies, with a new vision, and by helping overcome some of the barriers that we've seen so far. So one of the things that I'm amazed at in the 5 hours of conversation we've been having is that there's people from 6 continents, people, again, across the value chain. We have insurance companies, we have hospitals, we have clinicians, we have policy makers and other stakeholders, bringing these people together in one physical space, allowing for that free flowing of ideas, right? I'm certain that many projects beyond the learning collaboratives, also real world applications will come out of this. And actually, as Ancora, we're looking forward to meeting more of you. If not here at the conference, then online, and following up and seeing how we together can actually make a difference. So let me tell you a bit more about Ancora, right? So we're a Dutch startup. We've been active for the last 5 years, and we focused across really the whole chain of care, right? From prevention to remote patient management, so secondary, tertiary, and primary. We are an end-to-end population health platform that allows us to actually take the patient in a whole patient journey, right? From the very beginning, imagine with risk stratification for population health, prioritization of care, to the delivery of digital therapeutics, so for weight management, cardiovascular risk management, and to remote patient management of patients in hospital and at home. We have a number of initiatives that are centered around value-based care, and there's 2 we are very proud of. One is we are the first digital prevention program available here in Netherlands that is part of the basic insurance package, right? So through this program, we are actually remotely, with the help of lifestyle coaches and the primary care, coaching patients on a cardiovascular risk management journey, right? And that is where we've collected a lot of prompts focused on quality of life, integrated these prompts with other prompts on nutrition, activity, to get a really holistic picture, right, of the individuals, even before they're patients, because they're an at-risk population, but we are having such meaningful impact already in terms of weight loss, better cardiovascular risk management, and we're tying that to the clinical reported outcomes, right? So what we see is that in this chain of care for cardiovascular risk, there is a lot more engagement from the patients. There is very high response rates with this technology, and we are delivering real outcomes. And these people eventually, of course, you'll have cost savings, right? Because you're now acting on prevention. So I think we bring a new dimension to value-based care on the pre-hospital side. Within hospital, we're very proud of our partnership with Leiden Medical Center, where we are creating an ecosystem based on something they've validated for 10 years in terms of delivering patient care remotely, not just monitoring them, but managing them. How? Precisely through the integration of prompts, precisely by closing that loop, right? And giving something back to patients. Not just collecting a prompts data, not just collecting the clinical data, but engaging patients in their own health journey, engaging patients in their care, and making them a lot more central in that decision-making process. And we see, again, tremendous outcomes there. It's a model we are really looking forward to replicating also in other places that are now initiating value-based care, but are not there quite yet, and especially where that loop is not closed between gathering of the data and actually having an impact on clinical care.